Implantology is continually becoming a more commonly used procedure worldwide. Implants, retained over dentures, have nowadays reached an excellent technological level, but are only affordable to the most qualified and best equipped labs. In order to make this procedure available to any social economic level, we need alternative techniques and procedures which, while respecting international standards of quality, can be practiced and adopted by every lab by simply using the standard equipment available and be able to reduce time and cost in order to deliver affordable prosthetics to any social level or status. Using Rhein83 castable and titanium components, it is possible to realize passive connecting bars solutions between implants. With a simple technique, savings on materials, and reduced working time for the dentist and laboratory. This video shows the step-by-step procedure in the laboratory to realize a bar connection following the annular block technique, also illustrated with clinical stages in the patient's mouth. A complete trial mask of the frontal dental arch is impressed in the laboratory after trial of teeth waxing up in the patient's mouth. In this case, 3 spherical titanium attachments and a castable abutment with screw for the existing implants are used to build the passive bar connection structure. Castable prefabricated components will be used to wax up the structure and overstructure of the bar. Laying on the occlusal masticatory plan, use the extension arm of the parallelometer to trace the hypothetical insertion axis of the denture. Insert some extensions into implants analogs in order to detect divergences and evaluate case with existing undercuts. Put the castable abutment with screw into the most divergent implant. It will serve as a guide to find the right bar position when its hexagon will coincide with the implants. Screw titanium abutments into the rest of the implant's analogs. The most divergent one has already been set with the castable abutment and screw. Glue the 2 parts of the OT Box Classic component together. Split and cut away the boxes to be used over the titanium abutments throughout the spheres. Using the trial mask, mark the areas of the tissue ridge where OT cap attachments need to be located. Do not direct any sphere towards interstitial spaces in order to respect aesthetics. Cut OT cap bars with spheres, getting enough length. Insert them in between the boxes until the whole main passive structure is completed. It will be cemented to the implants in the mouth after casting. Prefabricated castable OT box components are used to build up bars structure. Mounting of pieces of bars with spheres will be done in parallel using their proper mandrels. Cure them with resin on one side only, to the castable pieces of the rings on the attachments. Wait for the resin to cure perfectly in order to avoid retraction, and proceed to cure the rest of the parts and the other sides totally until the whole structure is completed. Complete waxing up of the bar structure and cut down the castable abutment surface to the bar level. Sprue the bar positioned on the model, spotting the sprue pins along the most appropriate points where the bar surface dimension is thicker. Snap a black processing cap onto the spheres as a protection from the sandblasting. Try the cast bar on the model to check the annular block's rings and eventually enlarge them to fit and receive the cement. Remove, snap on the black caps again, and proceed with electropolishing. Finish refining and polishing of the cast structure on the sides and lower gingival surface using rubber burrs and brushes. Do not polish the occlusal surface. It will be done later on in order to create resiliency, which eventually can be increased by creating an extra layer painting over with enamel. Try the position of the annular blocks on the model, even using soft wax or silicone, in order to detect any wrong connection with understructures. Eliminate these connections where necessary with a burr. Fill any undercuts using wax and level all bar surfaces, the occlusal one included. Insert the positioner rings onto the spheres. To stabilize them, use some soft wax and then add additional wax to level them. Isolate all areas with gypsum resin insulate. Split some OT box special and use only the boxes. Snap them over the positioners. Start to build up the overstructure itself using self-curing resin to be distributed in sections of it. Incorporating also the boxes, and then wait for every section to cure in order to proceed joining these pieces together in order to define the whole overstructure shape. This procedure avoids risks of retractions. Using trial mask, position reinforcement pins for anterior teeth, taking care of the available spaces. Screw the structure. Remove it from the model, being sure the positional rings remain steady on the model over the spheres and not follow inside the overstructure to be investment filled before casting. Refine any excess resin using a burr and smooth up surfaces if necessary with wax. Cast and sandblasted overstructure. Polish it without wearing out the cast boxes for retentive caps. Insert black processing caps into the boxes by using the insertion tool. They will firmly click into position. Try bar insertion and check the whole assembly. A chrome cobalt alloy has been used in order to obtain a strong but lightweight cast structure. Proceed with electropolishing, leaving black caps inserted into boxes as a protection. Unscrew the bar structure and the attachments from the model. Bar has been previously polished on its surfaces beside the occlusal one, so that below the sphere level it is still unpolished and rough. Now it is time to polish the surface, reducing it in order to have no contacts between the bar and the overstructure. Insertion and functionality will benefit from this procedure. Check dimensions using the trial mask and adjust any excess surface if necessary. Grind teeth to be adapted to their reinforcement pins. Make up metallic parts with appropriate enamels in order to color their appearance. It can be helpful to block teeth on trial mask using superglue to ensure they will be in position when using it. Your choice of personal procedure can be used to finish the denture. The size of these dentures can be adjusted case by case. You can have a full-size denture, a reduced palatal denture, even a non-palatal and tissue denture, like a fixed implant-supported prosthesis, where shape follows only the teeth and does not lay on any tissue or palate, with lots of benefits for aesthetic, phonetic, and hygiene. Annular block. Passive bar connection between implants. Cast structures obtained by prefabricated components assemblage. No models investment duplication. Single castings, no welding. Reduced working time. Dental office stage. Finished denture in the patient's mouth. Finished denture. Parts and components. Resin denture with cast reinforcement. Cast bar supported denture. 3 spheroblock titanium abutments with 1 screw. Screw titanium sphere abutments into implants using the proper universal screwdriver tool. Insert bar. Annual blocks will position automatically over the spheres. Cast bar's hexagon will connect with the implant's hexagon, and by tightening down the screw, passive position will be found. Carefully check on the annular block's connections. Rings must fit on the spheres passively. No connection of any type has to be detected. Otherwise, grind around the rings or the titanium of the attachment if necessary. Check out presence of passive position. Fill rings with self-curing composite cement. Insert denture in the patient's mouth and have him bite down on it. When cement is cured, remove denture and remove any excess material. Polish composite. Hygiene has been respected. Denture has been made, preserving proper spaces for the patient's daily cleaning routine. Passivation, aesthetic, stability. Annular block. Passive bar connection between implants. Dental office. From impression and denture's delivery, it will take only 3 to 4 sessions. Finished denture positioned in the patient's mouth, skipping bar trial session. Simple performance and very good functionality. With these procedures, we need to point out the fact that besides the many practical advantages they provide, they also dramatically reduce stress and time-wasting visits by the patients to dental offices or trials of temporary dentures and versions of the metallic structures. In fact, no intermediate setups are necessary after trial of wax teeth bite in the mouth, since metal structures are built up immediately and the denture is finished, exactly like in the case illustrated. This technique always allows creation of passive connection bar retained dentures, even in very complicated scenarios, which otherwise would only be resolved through complex and difficult solutions. Connection between fixture and abutment will always be a titanium to titanium one. For casting of the bar and annular blocks, any other metal alloys may be used. If needed, to remove an annular block bar, you just grind out the composite linking the rings and the spheres. Even if some surrounding metallic parts are touched by the drill, don't worry. They will work as a retentive undercut for the next composite curing sessions. With this introduction, we will now show some actual clinical cases by summarizing the simplicity of passive retention solutions useful for professionals like dentists, prosthodontists, and dental technicians who want to adopt simple, functional, and secure techniques, while at the same time respecting the biocompatibility and aesthetic rules to realize prosthetic projects addressed to any patient at any social status and economical level. After the temporary denture has been removed, spheral block attachments are screwed into implants. The removable overstructure must also be tried in the patient's mouth before cementing the connection bar. In order to give a sort of stability to the bar during trial stage, a green positioner needs to be inserted over the sphere most parallel to the castable abutment screw. In order to detect improper connections between the annular block rings and the spheres, when the bar is in position, it can be helpful to spread them out with some soft wax before inserting. Then remove the bar and eliminate any excesses if necessary. Insert only 2 or 3 elastic retention caps into the removable denture. Replace the bar and screw it tightly in place. Insert denture and check the articulation. Detect bad connections and eventually eliminate them. Check while masticating. Thanks to the few elastic retentive caps, the overstructure can be inserted and removed without any problem, even though the bar is not cemented yet. After these trials, unscrew and remove the bar. In addition to the soft wax layer, also insulate the bar sections connecting to the tissues, but do not insulate the internal area of the annular blocks. The removable structure needs to be insulated too. Remove any remaining grease that might be present from every part that is to be cemented. Use a dual paste, non-light curing composite to cement the bar to the spherical attachments. Spread spheres with some cement, insert the bar, and tighten the screw. Completely fill the annular rings with the rest of the cement, even pressing it inside if necessary. Have the patient bite down on the denture while it is in place, and keep it firmly in place until the cement cures. Remove denture, refine and polish cement. Any excess material coming off the gingival ridge can be easily removed thanks to the soft wax barrier. Educate patient to perform a very good daily hygiene, using the proper devices to brush every area in order to avoid plaque accumulation. Main bar passively cemented. Removable denture with incorporated cast overstructure. 6 elastic retentive caps. At first checkup visit, retention will be monitored. It can be either left as it is if the retentive strength is valid, or caps can be replaced with some more retentive caps. Annular blocks technique give optimal aesthetics and stability using minimum space, like a fixed prosthetic solution. Dentures margin are usually sealed to the gingival ridges in a very good way, allowing excellent phonetics and avoiding saliva or air dispersion. Patients can be assured that no inconveniences will disturb their social life. Second case. Annular blocks cemented on 3 implants located in the lower foramen area. Passive connection between implants allows good retention, but also a resiliency which is very helpful to distribute loadings uniformly over the 3 implants. Third case. Edentulous maxilla. Mono-screwed bar. 4 annular blocks. In-mouth view of main bar structure. Inserted denture, fixed bridge bolt-like. Full X-ray. Detail with evident altered bar implant connection, caused probably by an imprecise location of the fixture in the mouth and the analog on the model when work was done. Problem is solved with refining the attachment sphere located into annular ring. When work is done, cement will lay into annular blocks slightly above gingival margin. A small gap between attachment and ring is evident, but it won't compromise the final result. Finished denture, selective grinding. Fourth case. Patient's mouth and full X-ray. 19 implants, 1 root. Fixtures are different from one another and have been implanted over a period of many years in different stages. Several dentures from past procedures never satisfied the patient's needs. Since implants are all different, they are studied to identify brands, the right diameters, threads, and shapes. A work project can now be planned. Finished upper and lower prostheses. Components analysis. Upper and lower bar connection between every implant. Two dentures with annular blocks passively retained double structured. Connecting bars with annular blocks and spherical OT cap attachments cemented onto implants. Removable dentures with cast structures and retentive caps of different colors and retentions inserted into metal boxes. Denture in the patient's mouth, centric occlusion. Patient smile. Final checkup X-ray. 2 additional second dentures with no cast reinforcements are requested by the patient for its peace of mind. Exceptionally for this prosthetic project, Rhein83 has provided its own educational laboratory to realize them for the dentist, who couldn't use his regular laboratory because they were unable to deal with this kind of works. Rhein83's operative micromechanics department also provided essential tools to identify all implants' origin and shapes and measure up the diameters and threads. Assisted by a mechanics specialist and a dental technician, the dentist has worked with skill in the patient's mouth to determine the correct measurements in order to manufacture, especially for this case solution, all the abutments, analogs, and threads necessary for the stone models. Without these custom-made components, this case would have never been resolved. With the variety of these showed cases, we want to point out that annular block technique is good to solve many solutions, from simple ones to very complex ones, just using prefabricated castable components for simplifying procedures. Any metal alloy can be used for cast